Up next, an organization in Long Island City teaching students about the gifts of life.
Yeah, Pat, some really important work goes on in this room every single day. This is the Kidney Recovery Rescue Center here at LiveOnNY, New York, which is an organ procurement organization. And yesterday, I was here as about 25 high school students got to see what happens here. It was something. We'll tell you more coming up when the news continues in NY1 from right here in Long Island City, Queens.
A group of Queens students is learning more about organ donation from an organization in Long Island City. Roger is there with more on what they're doing to help raise awareness. Good morning, Roger.
Yeah, Pat, good morning. And this is something that I think all New Yorkers need to know more about. You know, if you did decide to be an organ donor and you have your driver's license and you check that box, well, what happens next? What happens if that time comes when you become an organ donor? Or, you know, so that is exactly what this program is all about here at LiveOnNY, New York.
So these kidneys were recovered in the early hours of this morning.
These high school students from the Institute for Health Professions at Cambria Heights are seeing something they likely haven't seen before, a pair of human kidneys inside mechanical pumps, one minutes away from being transported to a recipient, the other waiting for a match inside what is known as the rescue room at LiveOnNY, New York.
We are extending the lifespan of this kidney while we're making sure it goes to the perfect recipient.
It's all part of the students studying to be pharmacist technicians tour of LiveOnNY, New York, one of 56 federally designated organ procurement organizations in the United States. LiveOnNY works with 100 hospitals in the region as part of their mission to get gifts of life, organ donations to people around the nation.
About 65% of these gifts of life move outside the New York metro region to the sickest people on the wait list around the nation.
What we do is we run scenarios in here with our transplant coordinators, and we test their ability to critically think, to assess the patient.
Inside the Donate 8 Simulation Center, which not only enhances training for clinical operations staff, but educates the public about the organ donation process.
We want to make sure that we give the opportunity to fill in the blank, to educate and engage our community, dispel urban myths and legends.
Students hear from staff who have personal connections to organ transplant. The school's Dean of Students, Chriselle Thorpe, says the experience brought her full circle. She is a kidney recipient.
To bring awareness and just showing the impact that being an organ donor can have, I hope will help my students when they become of age to, you know, either say yes or no, but to have the conversation and to think about, about it.
For those students, the experience was absolutely thought-provoking.
It really opened my mind to the idea of wanting to be an organ donor. Not everybody has the chance to live a long life, so it would really make a big difference for you to be that person, to change that person's life.
Leonard Achan says what they hope to do is let people in and take away the mystery from what organ donation is about. And Pat, think about these high school students. So yesterday, not only did they know that their Dean of Students, her life was saved by receiving a kidney, that another person that they heard from got a new heart, life saved, that another person they spoke to had lost a child, but that led to two other children having their lives saved. And then they walk out of this building knowing all this. It's really something.
Yeah, and so important to think it through before a tragedy hits. Roger, thank you.
Yeah, Pat, I'm in the OR here at LiveOnNY, New York. And LiveOnNY, New York is an organ procurement organization. There's about 56 of them around the United States. And what they do every single day is save lives by getting organs to recipients from donors. And joining us now to talk a little bit more about what happens here, Christina Jeske, Senior Director of Recovery Services at LiveOnNY, New York, standing next to a mechanical pump with a kidney in it. And that kidney will be going to someone soon.
Yes, correct. It will be. So this kidney was recovered last night in the early hours of the morning, and it's currently being allocated to find its new home, hopefully sometime this afternoon.
I mean, it's incredible. So, and you get it in here and in the OR when it first comes in, and there's some things that you need to do to it before you get it ready to send to somewhere else, right?
Yes, correct. So in the operating room, when we recover this kidney, we're going to flush it with preservation solution. We're replacing the donor's blood with preservation solution to optimize the transplant for the recipient. We're also going to package and label, and then it comes back to us, and we have it on this pump today, and we can troubleshoot and fix whatever we need to and optimize this for its recipient before it heads on out.
And I was here yesterday with this great group of students from a high school in Queens, and they were learning, and you were giving a presentation along with your coworkers, and it was really fascinating to see their faces as they learned about this process, because a lot of these things are kind of a mystery to most of us who aren't in that world, right?
They sure are. So you don't learn about organ donation in high school, you don't learn about it in college, so having these tours is really important, especially with our youth in our community, and discussing what is organ donation. We talk about career pathways, we talk about how all of the health sciences support what we do, but we also talk about opening up that conversation. Are you an organ donor, and do you want to be? And it's a yes or a no, and that's your own personal decision, but we want these children to leave our office after these tours and go home and have these discussions with their families. We want everybody to have these conversations so that if time comes and somebody comes to you and says, hey, does your loved one want to be a donor, they know the answer.
And officially, it's the Donate Aid Sim Center simulation. And there's one room that you brought us into where, I mean, it was very realistic. You have a patient who's blinking eyes, and the students were able to take its pulse and everything. Unbelievably realistic. Yeah.
Absolutely. So we use it to train our staff internally, and we make sure that our staff are competent and confident before they deploy out into the field. But we also use it to educate our community as well. So we have these high school students, college students, but we also have community members from all over. We'll have tours for anybody interested in learning more about donation, and they can see what it looks like inside of a real ICU room and how it is that we interact with families and hospital members.
Christina Jeske, you've taught me so much in this past 24 hours. I really appreciate everything you do, and thank you so much. We appreciate it.
Absolutely, my pleasure. Thank you.
All right. If you want to find out more, Pat, it's Live On New York, but it's LiveOnNY.org. And, the numbers are pretty staggering. There's 8,000 New Yorkers. 131 of them are children under 18 who are waiting now for a life-saving transplant, and more nationwide, 100,000. So this is the real deal. This is a serious business, and this is what they do here at Live On in New York.
Important work that they do. Roger, thank you.